Welcome to this European Society of Thoracic Surgeons Women in General Thoracic Surgery and Women in Thoracic Surgery webinar series brought to you by CTSNet. Women in Cardiothoracic Surgery, United Globally for Progress. Today's discussion will be centered around women as leaders in CT surgery and how they got where they are. We're glad you could join us. Please note this webinar is being recorded and will be available next Tuesday on ctsnet.org and CTSNet's YouTube channel. At this time, I'm pleased to introduce the co-moderators for this webinar, Dr. Yolanda Colson and Dr. Jennifer Romano. Dr. Colson is a thoracic surgeon at Massachusetts General Hospital and former president of the American Association for Thoracic Surgery. Dr. Romano is a congenital cardiac surgeon at the University of Michigan Medical School and the current president of the Society of Thoracic Surgeons. Thank you for joining us, Dr. Colson and Dr. Romano. The floor is yours.
Thank you. Thank you very much, everyone, and thank you for joining us. I want to thank for this invitation to Drs. Pompili and Antonov and to CTSNet for hosting this webinar. I also want to thank my co-moderator, Dr. Romano, and to our four esteemed panelists, surgeon panelists, and to our audience for taking the time today to explore this topic. I'm pleased to introduce this group of cardiothoracic surgery professionals to our audience. The first of the panelists is Jessica Donington at University of Chicago. The second is going to be Isabel Opitz, University of Hospital Zurich. Dr. Nuria Novoa, Puerto de Hierro, University Hospital Madrid. And Anna Oles, University of Southern California. Thank you.
We'd like to quickly remind the audience that they can type questions for any of the panelists at any time by using the Zoom Q&A function. Questions will be addressed following the conclusion of the final presentation. There'll be one presentation provided by each of our panelists for a total of 4 presentations. Following the 4th presentation, the panel will open to general discussion with input from the Q&A. Without further ado, we will open the floor to Dr. Donington's presentation, Women in CT Surgery, Institutional Leadership. Dr. Donington.
Thank you very much. I hope you can all see my slides. And thank you again to Dr. Antonov and Dr. Pompili for this kind invitation. I'm going to talk about institutional leadership, which is kind of a fun topic. I was pretty excited when I got this. These are my disclosures. Actually, almost none of them are relevant to what I talked about today, which is unusual for me. So I just want to start and talk about why it's important and what's different about institutional leadership and that which we do on a national and societal level. You know, the impact on that when we talk about those work is very kind of global and national and how we disseminate knowledge. What we do on an institutional level is really about what we do on our home turf, how we control the places where we work, where we show our faces every day. And for that reason, some of the skills are the same, but the impact is really much more, I think, direct. So today I'm going to just kind of go through the basics of why, what, when, and how. And since this was about institutional leadership, I'm going to show you my institution. So this is our beautiful campus at the University of Chicago. It is not Hogwarts. This is where my undergrads go to school every day. It is beautiful, but they do say it's where fun went to die. So why should you take on institutional leadership? One, I believe that as cardiothoracic surgeons, I think you should always remind yourself that you already are a leader. You grew up as a leader, you lead a team every day. So you have skills which many other doctors in your hospital do not have. And I really believe that. I also think you need to know that this is kind of required. You know, it's part of academic promotion and reimbursement. So if you want to move up that ladder, you have to take on some of this, or at least it's one of those things that makes you more valuable to your institution. And, you know, we all know as cardiac surgeons that RVUs drive a lot, but leadership also brings you value. I also think you probably have important contributions. Again, we are women surgeons. We are a minority everywhere we work, and therefore your voice and your opinion matter. I think most of us would probably be good at it and enjoy it. And as I said earlier, this directly impacts the place you go to work every day. It impacts your reimbursement, your work environment, the people you work with. So I think it is important. The what? Here's one of our famous gargoyles. I love them so much. So if you're at an academic medical school, medical center, the leadership roles kind of, I think, fall into 4 basic buckets. One I call academic, and that's kind of your chief's chair kind of ladder, but then there are also opportunities which are more interdepartmental that you can think about. If you do any type of research, there is a huge and massive research infrastructure at your university, and you can definitely work anywhere within that. Education is its own basket, and again, very separate, working with the GME office, ACGME, different leaders, different roles. And then, the one that's really unique in a way is the clinical, and that is really the hospital administration. Those are more like service line directors, be that the Cardiovascular Institute or the Cancer Center. And it is a little bit of a different role than the others. I also think it's important when you're in any of these jobs to know who your boss is. And these 3 buckets really answer to the dean's office. And that is the very academic side of what we do. And this one tends to report to the hospital president. And I have worked in institutions where that is the same person. And I have worked in institutions where those guys don't get along. So I do think you have to know who you're reporting to as you take these leadership roles. I think when you are at a non-academic medical center, I do believe clinical operations is probably king. But I think any place that does cardiothoracic surgery will also have opportunities for research, education, and medical staff development, because those hospitals are going to be big enough where they're going to want to do trials, be they clinical trials or device trials, or have, a registry, and they probably have learners of some sort on site. So again, you could take on those leadership roles. You'll probably have a dashed line to a dean at a medical center somewhere. But I think most of these things are going to report to a hospital president or to a board of some sort. So now I'll go through each of those baskets a little bit. So academic affairs, what does this mean? Isn't research and education all part of this? I do think they are, but I think this is the part of my job that really focuses heavily on faculty recruitment, development, and promotion. And those are important things that you don't really think of, I think, maybe when you're in training, but they're a very important part of what I do as a section chief. And I do think there are really important opportunities within academic affairs for interdepartmental and extradepartmental leadership. And those are on committees like wellness, DEI, appointments and promotions. I don't have my own DEI committee in my section of 4 surgeons, but we have one in our department. We have one in our university. I also think it's really fun when I'm on the extra departmental things to be integrating with basic science departments. I sit on promotions and appointments with molecular biologists and people like that. It is very interesting to remind ourselves that clinicians don't run the whole institution. Next is research. Again, research dollars are the feather in the cap of every academic medical center. They get graded on this and they care, and research is super varied. I do say that in my years, I believe that research leadership is really dominated by the medical doctors, and maybe I would choose the word non-interventionalists. And that's because our time is really valuable in what we do clinically, and they tend to have a lot more time for this. But that also means that surgical input is so desirable. They are so hungry for surgeons on these committees. It's not even funny. And it also means your voice is so important, because otherwise the decisions are going to be made by a bunch of pediatricians who don't have any clue of what our research is like. So again, if you do a reasonable amount of research, you should really be looking for leadership and involvement here. And why things like IRB and ICAC are the most well-known of those committees. When I go to my research page at my institution, these are all the committees involved in research. These are all the places where you can have a role and that you should be looking at. And most of these can get really quite focused on stuff that is very close to what we do. Education, again, tremendous opportunities, and they spread from the undergrad through the medical, GME, ACGME, CME level. You can do all of these. And while things like clerkship directors and program directors are really the top of this, those are really incredible time commitments. And maybe not for everybody, because this is a lot of work. And you can definitely base your entire promotion on this. You can get reimbursement for this. It is still a ton of work. And I think that one needs to also look at smaller roles that you can test this out, things like focus groups for medical students, taking on specialized curriculum for your residents and fellows. I think a lot about robotics and simulation here, where you can really take a huge role in doing something you love. Or actually, CME activities. If your section or department does an annual CME event, taking that over is an incredibly valuable thing and a great way to be an educator, even if you don't like residents. I should have made about 12 slides on this, and I just have one. I think that hospital-based leadership roles are great places for surgeons and for cardiothoracic surgeons. And these are the clinical service lines, ambulatory operations and perioperative care. I do a lot of work in perioperative care. It is unique, obviously, to kind of surgeons and anesthesiologists. I think it is a tremendous place to work. I just love my time there. And that is, and I like it because the operating room is really the engine of the hospital. We make the money. COVID showed that to us. When elective surgery closed down, all of our medical centers went into disarray because suddenly they weren't making any money. And so I think focusing on the clinical machine and making that more effective is really exciting. And we have a lot of power. We make the money. We have voices. But the work here is very kind of metric based. It's quality, it's US News and World Report, it's productivity and volume. You do work with a mix of physicians, but they're all kind of a little bit more toward what I like to do. And there are not a lot of pediatricians and rheumatologists in the crowd we work with here, and lots of kind of business administrative people. And if this is something you like, you might want to think about an MBA, but I have really enjoyed my work here. And like I said, as surgeons, we have a lot of power. And that is because, one, surgery drives revenue, and as cardiothoracic surgeons, no one makes more money than us. So your voice matters here. When to start or when to do this stuff. I believe you start this stuff early. You start small. It's okay to say yes to a lot of things, but within 1 or 2 years, you've really got to start focusing that down to determine where your likes are and where your strengths are. I think it's really important as a junior faculty, and I tell mine this all the time, you need to own and lead something. You need to be something that is yours, something that when you don't show up, I miss you, or someone in this building misses you. This increases your value within the institution. That should be something you like, obviously, something that aligns with your clinical interests, but I think you need to do it. I also tell them to embrace their work at satellite hospitals. This is a chance for you to lead. I lead something. It is mine. And when you're there, you have to quickly determine how you're going to measure your success. What am I going to do here to make this better? And how am I going to metric that or mark that or show that to my chief, my chair, my hospital administrator? And I think you have to look at problems there as opportunities to, really impact change. The other thing I tell my junior faculty, I am okay if you give yourself a title. I am the leader of this, and there's only one person in that group, it's you. Hopefully you listen to yourself. But if you're there and you have a title, you better do something. You have to be able to write something under that on your CV. I was the chair here, or I was the director of this, and I did these 3 things. This is kind of like my little road. I just cut and pasted this off my CV yesterday. So my early career, what did I do? I sat on a lot of committees at Stanford related to thoracic oncology because that's what I did and that's what I liked. I moved to NYU for my mid-career and I still kind of sat on committees related to thoracic oncology, but now I was suddenly the director of the lab where I was working. I became the associate program director. I was the chief at the satellite hospital. And I thought those things all really were the step up where I got a lot of responsibility. And I put lots of little dots on the CV underneath them of things I did in those roles. And then boom, I hit the University of Chicago. And now all these opportunities open up where I have, significant leadership roles within our cancer center, within our peri-op committee, and then on committees, both interdepartmental and extra-departmental, along with my section chief role. But I only got those because I had already been doing the other smaller jobs. How do you do these things? How do you take this on? One, I think leadership training is really important. It is essential and lifelong. I don't currently have a coach, but I'm really thinking I should get one. But places like the AATS, SDS, and Brandeis all have great courses focused on surgical leadership. And I think they're important for everyone to take, and to take more than once. These lessons are, like I said, important. I also think it's really important to take those classes if your institution offers them. I took them at NYU and I took them at the University of Chicago. They were very different and they were both super important. This is where you get to meet and interact with your institution's leadership, and they get to meet you. And then you get to better understand what your institution values. And that was the really kind of funny thing when I went from NYU to the University of Chicago. They sound similar, right? Big medical centers in big cities, they should be the same. They're totally different. Their values are entirely different, all within the academic mission. And it was important for me to know that and not spend 4 years figuring that out. You also get to meet those people in other specialties who are like-minded to you and have a similar vision, and you get to really refine your area of interest. So I'm just going to end with kind of my pearls on leadership, and this is what I share with my junior faculty too. I think you need to align your leadership positions with your clinical and research interests. This just makes sense. This is what you like, and this pushes your career forward. When you have a leadership position, you have to show up. Face time matters, and especially when your leadership position is at your home institution. People will notice if you are not there. If it's your meeting, you need to set an agenda and you need to stick to it. Everybody's busy and no one wants their time wasted. You need to walk the walk and be ready to do the extra work. Again, if you're the leader, this is your job. And again, most important when this is at your home institution, I think procrastination is never a good plan. So putting off bad conversations or meetings aren't going to get you anywhere. You need to know when to ask for help and admit when you are wrong, because if you start taking a committee or a path down the wrong way, the implications can be significant. I cannot overestimate the power of saying you are sorry, especially to people you are going to work with every day. I actually almost did something mean just so I could say I was sorry, because there was a nurse I wanted to get along with better who was in a powerful position and didn't like me, because I get the power of walking up and telling someone, oh, you are so right and I undervalued you and I will never do that again. And I do think, especially at your home institution, you need to be authentic. You cannot lead like some other guy did it. He did this, so I'm going to do it. These are the people you see every day, and they will know if you are not being yourself. So lead as yourself, and you will always be more successful. And I think that's it. I thank you all.
What a terrific talk. That is a fabulous talk, Jessica. Thank you. To those of you in the audience, I want to encourage you to please continue to use the Q&A function. You must have a million questions after that talk. Put them in the Q&A and we'll talk about them later. We're going to transition now and open the floor to Dr. Opitz's presentation, Women in CT Surgery Societal Leadership. Thank you.
Thank you for the kind introduction, Yolanda, and really great talk, Jessica. I'm looking forward to the discussion. I made a picture of the pearls and we'll spread it. I feel very honored to be part of this panel here today, and I would also like to express my gratitude to Dr. Antonov and Dr. Pompili for organizing this great webinar. And my part in the next few minutes will be to talk about leadership in scientific and cardiothoracic scientific societies. So these are my disclosures, like for Jessica, nothing to do with this talk. So let's have a look at the current situation. And this is just published a nice paper from Gender Representation Among Speaking and Leading Roles at European Cardiothoracic Surgical Annual Meetings. And I would like to thank Dr. Pompili for providing this slide here for me. And you can see the proportion of female session leaders when we look at the start in 2017 was definitely rather low in all adult cardiac, congenital, and thoracic, maximum 15%. And it's really reassuring to see that over the past 4 years, this has in all specialties, besides congenital, increased nearly significantly and relevantly, I would say most in adult cardiac. And when we look at aggregate data from these 4 years about the moderators as well, panelists and speakers, there's still a very relevant proportion of only male contribution in the surgical societies and in the meetings. So this does not really reflect the leading roles in the society. And I would say this panel here today is the best example that nowadays the situation has definitely changed. And there are like all of the representatives and moderators here on this slide have some significant role in a board of a relevant society for our field, if not even presidential or upcoming presidential roles. So I think the current situation looks much better than 4 or 5 years ago. And I hope that with this webinar today, we will all motivate our audience to engage more, to also become leaders in these scientific societies. So I will speak in the following slides mostly about the European Society of Thoracic Surgery, but I'm very happy that we have here Dr. Romano and Dr. Colson later and Dr. Donington to all speak also about the other societies. So the European Society was actually built in 1993 in November. That was a meeting in Heidelberg in Germany, where it was the first European conference on general thoracic surgery. So in Europe, traditionally, this was split from cardiac. And here you can see a nice picture of all the committee who built the society with Peter Goldstraw, who we all know, I guess, from the staging system, as well as the vice president, and Tony Leroux as treasurer, and Detlef Brandscheid as secretary general. I'm pretty sure you all realize that there's not a single woman on this picture. And that is luckily the past, because if you see today, how is the board constituted? So these are the officers and directors in 2023 of the European Society of Thoracic Surgery. And you can see Nuria Novoa and myself being officers and past president and president-elect of the society. And we also have on top of this 2 more directors who are part of the board, one from the Netherlands, Herman Schurz, and Katrin Welker from Mönchengladbach in Germany. So here again, the situation has changed. We also have a Women in General Thoracic Surgery Committee, and here again, Dr. Pompili plays really a relevant role for the society and is driving this for our society on a mission. There are several participants in this committee, one of them being Gunda Leschba. She is a thoracic surgeon, now retired, who works in Germany, but she was the first female president of ESTS. And we also have collaborations, as you can see here, with North American representatives, with Mara Antonov, Paula Ugalde, and Lea Bakros being part of the committee. And what is the aim? So this committee wants to advocate increased diversity in general thoracic surgery across Europe, and in particular with social media-based networking platforms and collaboration with other international organizations, and also in particular with mentorship programs, want to enhance the diversity in our society. So currently, it's 47 members, and this is also to understand here today as an invitation that you can all join this committee, and we're always happy to have interested participants. So one particular work of this committee I would like to stress, and here again, Dr. Pompili was having actually the biggest role, in setting up an academy for a limited group of fellows, and now for the second time happening, where overall here, these 8 fellows have the opportunity to be exposed to several clinical immersion, lectures, webinars, mentorship programs over a whole year. And I think this is really a unique opportunity. And besides this, it's really a lot of fun. And I'm sure Nuria will explain a little bit more about this in her talk. We're really having a great exchange and still in contact with lots of the fellows and follow them in their careers. But there are other opportunities how you can get involved in ESTS, and this is the same for the other societies, if I may speak for those too. There are working groups where you can get engaged, and you can see these are the ESTS working groups also listed on our website. And I'm pretty sure you will find something that you're interested in. Reflecting also to what Dr. Donington said, always go to these committees. What is your clinical interest? What is where you want to build your niche? Where would you want to become an expert? And here it helps extremely if you can exchange your mind and ideas with colleagues from abroad. So if you're interested to become more engaged in ESTS or other societies, it's a very good entry to start in the working groups and show up there and express your interest and engage in the projects of these working groups. Another part I would like to mention is also what was said in the previous talk is it's very important if you want to develop an academic leadership role, but also if not academic leadership role in principle, you have to know what's going on in your field. And this is why science plays such an important role for your career. And here again, the societies can support you. And this is the biology club of the European Society of Thoracic Surgery, built at the time and founded by Gaetano Rocco and Tommy D'Amico. And I had the honor to take over together with Gaetano for the following years. And you can see here, many, many fellows have benefited from research programs and research fellowships abroad. And here again, a very good opportunity to become engaged in a society. But ESTS is not alone in this fellowship programs. There are numerous also interdisciplinary fellowship programs where you have the opportunity to get sponsoring for your proctored research time, protected research time, and eventually fellowship abroad, which is always widening for your horizon. And last but not least, what I really want to mention, these societies, they are a great opportunity for networking. You meet people who are in the same situation like you are, and you can exchange so many ideas. And last but not least, you can also find friends. And this is also important for your career, that you find friends who are in the same situation like you are, where you have a critical and honest feedback. And this is something I'm counting on. Here, I have many people here in the room where I really would always count on their comments and remarks. And with this, I would like to draw your attention as well that in Barcelona, at our meeting in May 2024, this year, we will, of course, also have a very nice Women in General Thoracic Surgery event. And I hope you will all come, and I see you there for further chat with you. Thank you very much.
Thank you, Dr. Opitz. That was wonderful. It's so great to see all that's occurring around the globe to really support women within our specialty. We have lots of questions coming into the Q&A, and I encourage people to continue to use that function to provide questions for our panelists that we'll address at the end. And next, I would like to introduce Dr. Novoa, who's going to be presenting on women in CT surgery educational leadership. Dr. Novoa?
Yes, good morning. To me, it's almost lunchtime. Yeah, I think that you can see my screen. First of all, I want to also to thank the organizers and all the chairs for this kind invitation, because really I'm really very, very fond of this topic. And well, I has been as a director of education for the last 3 years, and I've been working a lot in cooperation with the former director of education. So I think it's a nice topic for these people that can be looking at the academic and the academic career. Okay, I have no relevant discussions for this presentation either. So we are going to cover a few things about, and what I would like to especially stress is that it's not the same, what I'm talking about is not the same to become a teacher that to become a leader in education. So I want to see some special differences between both roles. As you can imagine, probably surgeons and enrolled in education are probably the most vocational people that you can find around. We have this input to share our knowledge, and we not only want to share it, but we want to make a difference when we are sharing this knowledge. And to do that, we need talent, let's say, but a lot of hard work, as we are gonna say, and we are gonna see. When I'm talking about talent in education, I'm talking about identifying the core messages that you want to share with the people. Somehow having the capacity to summarize all the knowledge that is around those core messages in order to deliver a very straightforward message, and also having certain communication skills. But when I'm talking about communication skills, I'm not only referring to the way you express yourself, if you have a capacity to turn around your message in order to make it more easily understand by your audience, but also your capacity to adapt to them, and also the capacity to have a large patient to make this message to reach the really your target audience that sometimes is not so easy. So when you want to become a teacher in this, you want to do any academic career. There's no, you need to do your PhD thesis. This is a basic requirement. But whenever you start this contact with this academic career, and to get really at the end this official certification, there is let's say a straightforward path, but also there is some kind of what I have called an amateur path. Why? When you're going in this straightforward academic career, as Dr. Donington mentioned before, you somehow get involved in two areas. One is research, because you need to have your thesis done. So you need to work with a certain department in research that will provide you not only with your thesis, but also normally with some papers. Papers that come from your thesis, but also papers that can come from another people that is in the same unit, in the same research unit, also because you probably are going to cooperate with them in this situation. But also, if you are interested in this academic career, you can not only be, let's say, involved in research, you need to show up somehow to offer yourself for some teaching activities. As it was said at the beginning, maybe you will start just doing small things like collaborating in seminars, organizing some practical lectures, and maybe you have the opportunity to get to do some theoretical lectures, become involved in developing exams. So these kind of things can be done at the same time. So if you really want to become somebody within this academic area, you need to focus on research because you need your thesis, but also you need to have some teaching activities. One of the problems that is now happening in Spain, and I know that is also happening in several countries around Europe, but it's not what is happening in other countries in Europe, but also it's not happening in the United States, is that it's very difficult to guarantee time for research, for instance. This means that you need to take, let's say, an amateur, what I call the amateur path. And when you take this amateur part, it means that probably you will need up to 10 years to fulfill the minimal requirements for a basic official academic certification. So that's why I mentioned at the beginning, 10% talent, but 90% hard work. And when you get this minimum or this basic official certification, you will start having those basic responsibilities in the education within certain department. And this will allows you to, despite the contents, what you are gonna work on in teaching, it will be already delivered by the main people in these professorship positions. You will have certain freedom to deliver this content in a certain way. So it gives you somehow some clues to move forward in this, not only responsibilities, but also in the way you are able to develop it. So once you have this basic academic recognition, of course, you will like to go for a professorship position. And as it was perfectly explained before by Dr. Donington, there are these 4 areas in which people will somehow elaborate and evaluate you. Depending on where you are, the areas of the research they are going to look maybe will be a little bit different. This is something that you need to look in your settings. If you are in the United States, maybe this is not what they are going to look for, but it will be something very close. This is the type of things that we are evaluated in here in Spain. This is for research. This is for teaching. One interesting thing is that when you want to become really involved in academic career, you need to do also innovation and research in education, which is not something that you will do when you are involved in another areas. Of course, they will look also at your administrative work and your task. If you are involved in some administrative areas of your department, or if you are leading minor or not so minor educational activities, and of course they will look at your clinical work. But let's say this is somehow secondary, and this is it means that in order to fulfill the requirements for a professorship, you will need in Spain at least between 15 to 20 years in order to achieve those requirements, which is a lot. And this can be, it's also the same situation for some areas, I mean, for many places for instance, in Italy, but also in other countries around Europe. So I come back. Maybe you have a talent, you have the communication skills, you have the ideas, but you need to do a lot of hard work in order to get there. But what is the drawback of this? The drawback is that we are evaluated exactly the same as we were general clinicians, and exactly the same as for teachers of basic subjects at the medical schools. And they have a lot more time to do research, a lot more time to focus in, let's say, teaching activities. But we have a huge amount of clinical work. And this is actually a drawback. And it's making that now, at least in our countries, there are a deficit of teachers in surgical areas, which is going to be, they are posing a difficulty. But for this specific reason, if you think you have a talent and the skills to become involved in this academic career, go and take the lead and show up and say, I want to do it, because really we are running short on people. So, but on the other side, it's quite rewarding, because meanwhile you are improving you are going into this more faster or slower path. You will improve your communication skills. You are obliged to be up to date, so you increase your knowledge. You don't get behind, And also you increase your knowledge on educational tools. You learn how to use different type of tools, not only digital tools, but another ones. And also you need to keep up with your research interests. Otherwise you will be again behind. So this is quite important. This is quite motivating for the let's say for the teacher. But what is the difference in between what I mentioned as a good teacher and becoming a leader in education? Of course, the difference is becoming a mentor. And what is a mentor? And a mentor is somebody who is a strong believer on what he or she does. He has, and this person has to have a satisfying professional life. There's no way you can motivate, you can inspire people if you are not satisfied with what you are doing. And this means that you need to keep yourself up to date, otherwise you are just losing the opportunity. You have to be an example. I think that, again, Dr. Donington, she said it very, very precisely. You need to be there. If you are, if you have a meeting, you have to prepare your meeting. If you have a lecture, you have to prepare your meeting. I mean, your lecture, you cannot get there and just somehow do something. No, you have to cover it and you have to do it very well. So you can inspire other people just to do exactly the same. You have to, of course, you have to have this vocation to share your knowledge, but you cannot share only knowledge. You need to share this knowledge after a previous meditation in which you have to mature and improve whatever you have to say. Remember that the teaching experience is linked to a patient and experience, and you need somehow to elaborate on those things in order to deliver not only a strict scientific knowledge, but a motivated scientific knowledge. So, and somehow you need to look forward toward the future and see how it is going to be, because it will give you an idea in order to help your colleagues. So this brings me to really how the mentor will explain and or spread their role, which is the mentorship. When you are facing mentorship, you are not only vocational to share your knowledge, but also to make a change. You need to spread, and you need also the motivation to spread this change. Remember that the students and trainees, they will like what they understand, but they will love what they experience. So there is a lot of things that you can do, and you will step by step in your career get those tools to make your students or trainee experience what they are studying or what they are trying to manage. Of course, you need to adapt to your mentees. Somehow you need knowing how it's going to be the future. Let's say, okay, I will suggest knowing you to go this line or to take this another line. You need to be very patient and friend for a sincere counseling to your mentees. And of course, this is a bilateral relationship. You have to be open to learn from your mentees. So in conclusion, what I would say is that a good teacher needs to have a great share of vocation and motivation to develop a good job. But leadership in education is linked to mentorship philosophy. And this philosophy relies not only on sharing this knowledge or even the motivation, but sharing what can make a change, not only to the individuals. If you can, if you get a big role in education, like a director of education, you are delivering this change to groups. There is always a big role for innovation, not only in knowledge, not only in research, but also in education tools. And of course, you have to be open to have a bi-directional relationship with all your mentees, that probably they are individuals, but also in big groups. Well, this is what I wanted to share, and I thank you very much for your attention. Thanks a lot.
Thank you very much, Dr. Nova. This is another really interesting talk, and I think it really shows the highlight of the expertise of this panel. To those of you in the audience, thank you for your attention, and please continue to use the Q&A function to bring questions for the panel that's going to follow shortly for discussion. And last but certainly not least, and a very interesting topic, Dr. Oles will present leadership as a woman trainee in cardiothoracic surgery. Thank you.
Thank you so much, Dr. Coulson. Thank you so much for inviting me to be a panelist in this super important session. It's great to see this webinar series. I think it's really helpful. So I'm a resident at the University of Southern California. I'm in the Integrated Cardiothoracic Surgery program here. I'm on my second year of research right now, so I'm about to start my fourth clinical year in the integrated program this July, and then I'll have 3 years left until I'm done with my training. I'm also currently the vice president of the Thoracic Surgery Residents Association. So I'll try to provide some perspective about leadership as a resident and what I've done so far, as well as some advice I have for students and other trainees. So just as a disclosure, these are just my experiences and what I've learned along the way. So to give an overview of my experience so far, in med school, I initially got involved in leadership by starting my school's chapter of the Association of Women Surgeons. And I organized a speed mentoring event and several panels through that led to important connections for students. And the organization also helped me meet different mentors. And that is still going on at my school. I also started our cardiothoracic surgery interest group, which we didn't have one. And I was actually the first student from my school to apply to integrated programs. In residency, I got involved in TSRA as an intern. I signed up to write some book chapters, and I then went to the TSRA mixers at the STS and AATS meetings, and I ended up meeting the executive committee members, and they encouraged me to apply for the executive committee later on that year. So I applied as a PGY2. I was accepted, and I started as a general member of the committee as a PGY3, and I helped with various projects on the executive committee. Last year, I was elected as the projects committee chair, where I oversaw that committee and was able to secure industry funding to start a podcast series on anticoagulation and blood products. And this year, I'm serving as vice president, and I've started a wellness webinar series for residents and students in collaboration with the TSDA to bring discussion to topics that I feel don't talk about enough in training. Because of my collaboration with the TSDA, I started working separately on some wellness publications that have recently been accepted and published. And through my involvement and the connections I made in TSRA, I worked on a multi-institutional study with leaders in our field, including Dr. Amano, to do an STS-sponsored national survey of all cardiothoracic surgeons. We looked at pregnancy complications and infertility in female surgeons versus partners of male surgeons. And this spurred the creation of a session around family planning at STS 2024 and inspired a recent news article and interview by CTSNet. And this year, I'll be a resident member of the STS Wellness Workforce and the AATS Wellness Task Force, as well as my continued involvement in TSRA. So in terms of plan for the future, in the future, I plan to be TSRA president. I'd like to continue on the committees that I'm on and affect hopefully meaningful change in the realms of wellness and family planning. I do have 3 more years until I'm done, so we'll see what happens after that. So in terms of what's been important for me so far, I can't overstate the importance of mentorship. We all need mentors. It's important to identify people that you connect with who can fulfill this role. And I also think there are multiple types of mentors and different mentors for different stages. I have many people who I can call for advice, including other residents who are above me in training, including the other people on the TSRA executive committee. Also people who are now in practice who've graduated from my program, and people that I've met along the way at meetings or on away rotations, my own attendings. I still call my medical school mentors for advice, and I have some new mentors along the way that have helped me. So over the past few years, self-exploration has been integral for me. I've spent quite a bit of time thinking about what my priorities are, what I want for my life and my career, and what things specifically give me joy. Thinking about these things has helped me stay focused on the things that do bring me fulfillment, but it's always a constant work in progress. I've also volunteered for a lot of things over the years, and I have found that if you put yourself out there and volunteer for opportunities in your own program or within the leadership organizations, people are more likely to recognize you, remember you, and then promote you for something else. And that's how I got involved in TSRA and many of the other opportunities that I've been involved in. So in terms of advice, it sounds like I've done a lot so far, but at each step of the way, I have worried that I'm not doing enough. And I think that's a pretty common feeling. In medical school, I felt like I wasn't involved in enough things. I wasn't involved in enough organizations. And then in the process of all of these steps, I've spent a lot of time and effort on some things that were not aligned with my goals or my values, which unsurprisingly didn't turn out to much. So like I mentioned, I've spent a good amount of time thinking about my goals and priorities. And my advice would be to start by taking stock of where you're at currently, what you're currently involved in, and then asking yourself some questions. I think the first step is to ask yourself, what do you want for your life and your career? It's important to do the work to explore these answers by paying attention to what gives you joy and what fulfills you. It's better to do this early. And you can find leadership opportunities in many different ways, as you've heard, and it's possible to be creative. The most important thing, in my opinion, is that you're working towards goals that align with your personal values and mission. Otherwise, there is a risk of not accomplishing as much because you may not be as passionate about it. And when considering where you want to be in 5 to 10 years, in my opinion, it's important to make concrete goals and concrete steps that you can pursue and keep track of to make sure that you're on the right track to where you want to be. Some other things that I would recommend are to find a mentor or a sponsor, hopefully both, and hopefully more than one. And there are formal mentoring programs through the Women in Thoracic Surgery Society and through scholarship programs for the national meetings, as well as through the organizations themselves. And perhaps there's someone at your institution you can identify as a possible mentor or sponsor. It's important also to actively seek out this type of support because it may not fall into your lap. And you'll need to display some initiative. You'll need to schedule a meeting or email in order to show your interest and motivation. Another good way to meet people and get opportunities is by going to and networking at the national meetings. Introduce yourself at the meetings. It's okay to just walk up and introduce yourself to people. It's especially important to follow up with the people that you've met at the meetings via email afterwards to maintain those lines of communication. I did this. A lot of people that I know do this, and it reminds people who you are and that you're interested. And you can even ask to schedule a meeting to discuss your career in the follow-up email. I think being bold has a way of paying off. At least it has for me. And regardless, you have to start somewhere. Some good places to start are the scholarships that are available through WTS, STS, AATS for the national meetings. I did the Women in Thoracic Surgery Scholarship when I was in medical school, and I was paired with Lauren Kane, who was recently the president of WTS, and she has continued to support and promote me over the last 7 years since that partnership. You can also apply for resident leadership positions in STS, AATS, WTS, or TSRA, and there are resident opportunities available, so keep an eye out for them. They are advertised here and there. And TSRA has a bunch of opportunities for residents and students to contribute, whether that's joining one of the committees or contributing to one of the projects. Ultimately, the more you're involved in and contributing to, the more opportunities will come to you. And a few last things, it doesn't happen in a day. I've had, like I said, numerous days and phases where I felt like I wasn't doing enough or accomplishing enough. So it's important to set small attainable goals and work towards those, and the bigger stuff really does happen in time. Any connections you make, even if they seem really small, could lead to future opportunities. Like you met somebody in passing at a coffee station, talk to those people and reach out to them afterwards. Ask questions, put yourself out there, and don't be afraid to introduce yourself to people. That might be a really valuable connection for you in the future. You never know. And lastly, and very importantly, get involved in things that actually interest you, and you'll meet people with similar passions who want to work on similar things, and that's really when the great stuff happens. It's easy to want to be a leader and accomplish a lot, but I think it's important to figure out what motivates you. And advice that was given to me that I also think is super important is don't overcommit and underdeliver. And that's also why doing what you're passionate about is really important. It makes you motivated to get things done, and you're going to be busy as a resident and a fellow. There's only so much time in the day, and I was always told to have a couple of projects going on at once in case one falls through, but just make sure that you're able to, keep on top of the things you committed to, because that's the impression that you're going to set. And here are some resources that I just thought would be helpful. So I'll leave this up, just the TSRA website. You can contact any of us. And then WTS, STS, AATS all have scholarships and committees that residents can join, as well as mentorship programs. And then CTSNet has most attendings emails if you meet somebody and you want to look up their contact information. And they also have these types of webinar series that are super helpful. So I hope that this was helpful. Thank you.
Thank you, Dr. Holtz. That was wonderful. And trust me, you are contributing a lot. You are making real differences for women in our profession. And thank you to all the panelists. These talks were just simply outstanding with so many wonderful pearls of wisdom. Thank you so much for sharing. And a special shout out to Dr. Opitz, who is actively traveling right now and still participating in that panel. Thank you so much. Please keep putting your questions in the Q&A section, and we'll go ahead and work our way through some of the questions as time permits. Dr. Stiles asked an excellent question. This gets to the men as allies for women within the field of CT surgery. And this can go to any member of the panel to answer, but he asks, do you have any advice on how male surgeons can best sponsor and mentor junior female surgeons to position them for success? How important is it to find external sponsors if at your own institution you do not have female leadership? Everybody's looking for their unmute button right now.
I think I found it first. So I'm happy to start. So I guess my answer to Dr. Stiles is, first of all, I think probably all of us in this group were, got to where we are based upon male mentors and sponsors. There just weren't that many women when most of us came up. So I think you're an example of a great one. So yeah, you should keep doing what you're doing and mentor and sponsor your women just like you mentor and sponsor your men. At the same time, I do think, finding a female mentor from an outside institution is an important thing. I do think we probably all had questions and concerns at points in our career that we weren't super comfortable going to maybe our male mentor about. So yeah, I think we all agree mentoring and sponsoring, it takes a village, and we are happy to reach across institutional lines to support that village, because I do think we all have different roles for our junior faculty.
I mean, I think there's an important thing to bring up, the difference between mentors and sponsors, just for the audience, and that the mentor is the person you kind of talk about things, you think about plans, you understand maybe but it does not have to be in your subspecialty. You can work through a lot of these different avenues, and sometimes it's even business mentors, like you talk to them about business. So think broadly on the mentor side. The sponsors are people who make opportunities for you. So they have to be power brokers, so to speak, in the specific area you want to lead or be in. So those tend to be in at least some area of specialty, maybe cardiothoracic versus congenital or general thoracic or adult cardiac. You have to decide what you need. But their sponsorship, because of where the hierarchy is, are often men. And the mentors can be both men and women in understanding kind of your environment and what you're thinking and bouncing ideas off of. And I think that's why this external, internal becomes really important, and mentors and sponsors are important to understand that difference. The last thing I'd say is when you call someone up and you want to have a mentor, come with them with focused questions or ideas. If you come up and say, I want to be a surgeon and it's a broad question and plan my life for me, you don't get much out of that. And so come with very interesting questions, things that you've noted, things you want to do, so that when you leave the meeting, you feel that you have something and that the mentor feels that they actually added something. Yes, you can go and just visit, that's okay, but sometimes come with something you really want to drill down on.
Yeah, and I just would add to that, in terms of the men as allies, I think every single presentation talked about having that opportunity where you can show up and really demonstrate your worth and all that you can contribute. And that's one of the greatest things that our male colleagues can do is create those opportunities, make sure to promote us to that space where then you can have your moment in the spotlight to show exactly all that you can contribute.
Yeah, I would like to add one point. Currently, the new generations, they are not looking so much to their, let's say, to their seniors. They are somehow spreading the knowledge and they are copying each other, their peers. And this is a problem. This is a problem because many times you need somebody who give you some visual or can anticipate what is going to happen. And what to take this line or to take this another one, but you need somebody who can add something to what is just happening. So I would like just to highlight that despite maybe this position as mentors or sponsors can be close to you or not, they cannot be somebody who is almost like you. It has to be somebody who is older and can add a certain experience that you don't have. But this is easy. I mean, we are normal people, and we are everyone can reach us. So don't hesitate to get close, ask, and ask for help. This I think this is the key though at this point.
And I think we can go to another question in the Q&A box. This is from Dr. Fuller. I think this is also a really important talk. Everybody gave such inspiring talks of their successes, but how do you retain emotional strength and fortitude when you feel dismissed, undervalued, or underappreciated?
I personally think this is where my peers come into play. I think this is where the community of women surgeons has made the most impact in my career, because yeah, our careers are long and there are lots of times when it is not encouraging and you feel completely dismissed. And I think that's when I turn to my other female surgeons and say, oh, can you believe this happened? Can you believe this? And how do I get through this? And they remind you that this happens all the time and that it's okay, and you go on. And you do need to have people to talk to, whether that's, your partner at home but I think this is the group that understands that feeling the most and has been the most encouraging and supportive to me.
Dr. Novoa.
Yeah.
I would add something else. Because I get that the question goes about how we got the strength to move forward when this kind of things happens. There's no doubt about what you just mentioned. We need our peers at that moment, or even some female to help us. But I would suggest that in order to keep your mental health in good condition, I would recommend to do sports. I don't know, any kind, anything that you are able to keep on along the time. Doesn't matter. Do you like to swim? Swim. If you like to run, whatever. Because there is times in which things are very, very, go smooth and there is no problem. But when you have a bad time, you need, despite you talk to another people, you need to find your strength yourself. And it is absolutely related to how you feel. And you feel much better if you have something like that. So, but not only for this, but also, let's say, as you are getting older, you will find that the sports give you the strength to do much more things. So I think it's another advice to keep very much active.
I think we also have a real blessing. If you think about people in other fields, they don't have patience. And I think those are a real source of strength. No matter what's going on in the politics of the day, you go to the ward, you see your patient, they give you a hug, you realize what you did, and you realize that's why you're here. And I've always found that an enormous amount of strength. And then the other thought is that many of us were in an era with, you were the only woman. in the group. And so understanding that the network of women, especially CT surgeons, is across the globe. Like, we text each other all the time. We talk all the time. We go back and forth. And how did you manage this? And what's going on? And there are times where it's like every day you're talking to somebody on the drive home just to say, so what happened to you? Or talk not about work. And I think what you find is that you're not alone, and that makes all the difference. Or you talk about a great case, or you talk about something like that. And it's not to say the field is really mean or whatever. It's a hard field. We do hard things, and patients get really sick, and we have long days, and that's okay. We can do it. Sometimes you just need a friend as you go along, and that can be men or women or whatever, but somebody who you can talk to. And I think it's a great field because you get through those tough times. So.
Yeah, and I think, we cannot underestimate the power of vulnerability. I mean, it's so easy to talk about all of our successes, but when you talk to especially people who are early on in the process and trying to climb that ladder about where you stumbled, where you struggled, and how you navigated that, because it's very easy to look at somebody who's in a leadership position and be like, wow, they've had this amazing career, because what you've seen is that public facing portion of their career. You haven't seen some of those struggles that they may have experienced. And so it is so powerful for us to share our stories of successes as well as our stumbling blocks, because I think that really helps other people feel that they're not alone. Like, to Dr. Old's point of feeling like when she leaves the meeting, I'm not doing enough, but you're doing so much. And so it's supporting people in challenges as well as applauding them with their successes.
I wanted to bring up another topic just to get from the panel a little bit. And we talk a lot about planning, and I thought it was great because it was really nice example to see Dr. Olds was literally following the Donington playbook, right? It was, I did this, and then here's what I did with that. And I had this role, and here's what I did with that. And I thought, this is fabulous. One of the things that I wanted to talk a little bit was about, there's so much emphasis on people thinking that they have to have one thing and then carry that through. The role of serendipity is enormous in our careers. And I wondered if we could talk a little bit about leadership and the serendipity of it, or how you take some of these chances, or Dr. Olds made the comment about having two projects in case one falls through. So I want to open it up to the panel.
I can't say enough about that. I think hopefully as we all move through our academic careers and our non-academic careers, I don't want to move this all into academia. You're always prepared for that next thing that walks in the door. We've all had that experience where this is not what I wanted to study, and it fell into my lap, and now I've made a career out of it. I think it's just being ready and just being open-minded. And I definitely, some of the things I've been most successful with in my current position are things I never thought I could have any influence on. I mean, promotions, my God, I run the promotions committee for my department. I'm going to become a chair of the university one. I failed at promotions. I spent 11 years as an assistant professor. I was a failure. Absolute. But my failure has made me an expert about how you do it right. What are you supposed to be doing as a junior faculty to get promoted? And I do think it's those insights that have suddenly made me the expert within my department at something that I didn't think I was good at. But it's being ready, it's being open-minded, and maybe being a little honest and authentic that I didn't do this well. I failed, and I don't want you to fail. So here's how you do it better.
Yeah, I often tell students that I'm mentoring that, really pay attention to when somebody who perhaps is more senior than you or has kind of walked the path longer that suggests that you do something or promotes you for something, because they're probably seeing something in you that you don't see in yourself. And to realize that they're probably seeing that there's a place where you can really shine, and it may feel a little bit uncomfortable, but usually people aren't going to ask you or promote you to do something that they think you're going to fail at. It's something that they think that you're really going to have some expertise. So I think, again, that's where those mentors and sponsors that guide you, and sometimes into something that seems a little scary at first, are really valuable.
Dr. Nova.
No, I totally agree. I totally agree. Sometimes you feel you are not good at that, and you get an invitation or so, an opportunity in this, and you should take it. You should take it because it will
It's
improve
interesting.
your.
It's
It will be. It will
Sorry.
improve for everything in you. I mean, your career, your tools, your skills. So, no, I think you never should say no and step back unless there's something that is totally out of control. But in general, it would be a very good idea. Mm.
It's interesting because I think people don't understand the careers change over time. If you're doing the same thing when you started, especially in research, if it's 20 years later and you're working on the same problem, you probably didn't make as much progress as you thought. So you need to switch and you need to decide, that change is good and that it doesn't mean that you've abandoned something. It's an evolution. So it's that difference between quitting and evolving that I think is important. And there are things that I never in a million years thought I would do, and you take a flyer and it works out great. If it doesn't work out, it's fine. It's a short risk, right? You don't have to do it forever, but I do think it's important for people to understand that. Let's pull some other questions.
Can you see him okay, Yolanda?
Yeah, I can. There was a question here about some of them are fairly specific, which we'll try to answer in the chat itself. But there was this question about best timing during the career to commit for an academic degree as a PhD or an MPH. And I think it's we can make it a little bit broader about kind of when during your career you take these times to do research or education, and that can be at different times, not just as a resident. So when are those times when you take to kind of get new knowledge or to pivot to some new skill set?
Well, it is difficult to answer because there are many things that you have to take into account. In my opinion, to have a basic degree, let's say a bachelor degree, it should be done as soon as possible. As soon as you're studying in your specialty, you should move on this type of degrees. But when you are looking about something else, like to be involved in a major research to do your PhD, maybe you need to take into account things like what is the amount of time? I mean, if you are able to secure some time for research in case you need it, that probably you are going to need it, although the PhD can take forever. But I'm able, in my situation, in my current unit, unable to secure time to do research or not? This is one important question. And the other thing is how much I'm involved in the family issues. For instance, I would not recommend to become involved to do your thesis, your PhD, if you just get a baby. I mean, it will be a mess. I mean, well, you would have to choose to do one of the two things, and probably, well, of course, you would choose to dedicate your time for your kid. So there are some issues there, and probably one of the most important one when you are focused just on the professional life, you need to be sure that you are going to have time enough to secure in order to develop your project. Otherwise, it will take forever, and you will not get to the task, and it can make you in trouble. In trouble for two reasons. First, because you are not, let's say, you cannot be committed exactly to what you are looking at or you're trying to achieve. And the second time is because, meanwhile, you are not completing the different tasks, you are not attending things, you are not achieving goals, the small goals that you need before finalizing that. So to me, as a female, I think these two things are quite important. The amount of time that you can achieve, you can secure for research, and second, how are your family issues? How much time you got there? Because depending on that, you have to make a decision. It's not straightforward. I don't know your opinion, but I think it is something very important.
I think that's great. Thank you. We want to wrap this up right now, and I'm going to thank everyone for attending this European Society of Thoracic Surgeons, Women in General Thoracic Surgery, and Women in Thoracic Surgery webinar series, brought to you by CTSNet, Women in Cardiothoracic Surgery United Globally for Progress. And as a reminder, a recording of today's webinar will be available next Wednesday, March 27th, on CTSNet and CTSNet YouTube channel.
Please look forward to the next webinar in this series, Fighting Inequities in CT Surgery. Registration is free and is open. Please have a wonderful day. Thank you so much for joining. We really appreciate everyone's engagement.